first disease pandemic I went through, I was a nursing student. I went to school in New Jersey, and I did my clinicals in New York City at New York Presbyterian, and we dealt with HIV/AIDS. Back then, early 80s, people didn't even know what it was. People were terrified of it. We had, it really stressed the hospitals out. You had patients dying of infections that had been dead, stuff people had been immunized against for years. It was the unknown. And as a caregiver back then, we didn't have needleless systems like we did now. Like, I had stuck myself with HIV needles when I was a young new nurse because nothing was needleless. So I had lived through that. And when this pandemic came upon us, talking about your perseverance, talking about resilience, I drew back on my experience in New York and New Jersey working with HIV. At one point, New Jersey had the most HIV/AIDS cases of anywhere in the nation. So I had that to add to like my arsenal of strength in dealing with this disease. Yeah, people are right now stretched. The nurses are working as much overtime as they can. Not just the nurses, the doctors, all our support staff, our dietary staff, our cleaning people, everyone is exhausted. They're just trying to get through this. I remember early on in the pandemic, about 2 weeks into it, back in March of 2020, my sister sent me an article from Massachusetts Institute of Technology. I get their report email every week, and it said that this pandemic would last 3 years. And at first I was like, I was in disbelief, really? I thought that this would be 2 weeks and done for real. And when I saw the 3 years, I was like in disbelief, but it really is a fact. We're about 18 months into this. This new flood, this new surge, this tidal wave of patients has us stretched thin. If there was anything I could say to the public, to the community, it's please give your healthcare workers support. The best thing you can do to support them is to get vaccinated, and please wear the mask. I know a lot of people don't believe in it, but it is pure science. We've worn them in the OR for 100 years. Not one patient in America would want to go into surgery without their doctor or nurse having a mask on with their body open. So please use science. Early on in the pandemic, we got so much community support. It was awesome. We got meals from churches, care packages from different groups, letters from children. Your healthcare workers need that again. They are exhausted. A lot of people are leaving nursing, leaving medicine because they are burnt out. So we really need everyone. We're in this together as a community, as a population, as world people. We're all in this together. What we do, our behavior, our actions, our attitude affect each other, and our lives depend on it. Yeah, what it's like right now is Monday night, I did crisis staffing in a local emergency department. And there were no beds in that hospital, no ICU beds, no regular beds. And we had 2 people die in that emergency department, one of COVID. So there's less of you to give. There's less nursing time. You're exhausted. You're going to have long wait times in the emergency departments. Yeah, the overall thing is it has stressed the system. We are spread thin. Right now, we will be grateful and welcoming for any community help and support we can get. There's too many sick people. There's not enough vaccinated people. There's not enough people respecting and wearing masks. And we need your sympathy, and we're sympathetic to the public. We are taught as professionals to be empathetic and to care, and we care deeply. But when we're overwhelmed with the numbers, we can't do it alone, and we can't fix it all in the hospital. It's got to be the community and everybody working together. It's good teamwork. The ER I worked at the other night, one worker came in, our unit coordinator. She signed up for a 16-hour shift. She said, I didn't have time to get food. I gave her 2 of my drinks. Another nurse went out and bought her a hamburger. And then our doctor bought donuts for all of us. So it's pitching in, it's reaching out, it's being kind to each other, it's nurturing each other. There is not a day that goes by where you don't see somebody in an ICU bed who is struggling to breathe, who's on high flow, is going to be intubated, saying, why didn't I get the vaccine? Yes, every day. Yeah, the staff are exhausted. The EICU nurses will come home and just like a shell-shocked mentality. With my daddy, it was that way. My dad died of COVID April 2nd, 2020. We couldn't be with him. None of our family. My mom and my dad had been married almost 60 years. They were three months shy of their 60th anniversary. No one could be with him. What gives me great peace, though, is every doctor, every nurse practitioner I talked with over the phone, they acted like they had all the time in the world for me. So it gives me peace knowing my dad was with great people when he died. They let us do a video call with all my 5 brothers and sisters and I, all the grandchildren. And the last sense to go before you die is hearing. All the science proves that. You can pull all the studies. So they put the iPad up to my dad's ears and we all said our final goodbyes. So that's something we do here at Baptist. We do have iPads to be used just in the COVID room so people can FaceTime or video time their families. Oh, for sure. Like when I work EICU, there are times I look at my patient and it's a man that looks like my dad and I'm there with him. So, just drawing on that and using that strength to drive my empathy, to drive my compassion, to know that what I say to that family can work to bring them healing to get over this death. Well, right now we're shell-shocked. We're in crisis mode. It seems July 4th, pandemic's over. Masks are gone, and people are vacationing in the restaurants. So no surprise that 4 to 6 weeks later, it's back. And I draw back to the science, to Massachusetts Institute of Technology letter that said 3 years. So hopefully we're halfway through this, another year and a half. When people get vaccinated, when herd immunity builds up, we'll always have COVID. It'll always be endemic, but hopefully it will be better and it'll be manageable and the death and the trauma will be less. The biggest fear of healthcare workers is the system is overwhelmed. We can't get to your family member as quickly as we could before this surge. So we need to draw on help. We need sympathy from the community. We need support. All those good things they do for us. We are grateful and welcoming to any help they can give us. Yes. And sometimes we have people transferred from little tiny hospitals to maybe a smaller hospital that doesn't always have all the technology and support available at the main medical centers, because all the major medical centers in Memphis are full. So it stresses the system. It's yes. Mm-hmm. It's a domino effect. Yeah. Elective surgeries have been canceled at several hospitals. Labor and delivery inductions. Here at Women's, we have the busiest labor and delivery department in the city. We do amazing work. Our nurses are so dedicated, so smart. They're certified in their specialty. We've had to put off elective inductions. There's long waits in our waiting room. The system is stressed right now. I want to say thank you to all the support that we've had. A lot of churches in Memphis, children writing us cards, letters, care bags, little things like that can keep you going moment to moment through this crisis. Your caregivers are human. They run on their stomachs. They like food. Yeah. So just be respectful, be thoughtful. I know a lot of people don't believe in it until they're in the hospital situation saying, why didn't I get my vaccine? They're calling their families. They're putting on Facebook. I didn't believe in this. So please believe. We have integrity. We're honest. We're just hardworking nurses, cafeteria staff, EVS staff, physicians that are here to serve the public. And we've got to do this as a team. We need your help. We cannot do it alone.